Good morning. Today we'll learn about antiretroviral drugs. First, let's start to understand the difference between retroviral and antiretroviral drugs. Retroviral drugs are retroviral and non-retroviral drugs. Yesterday we learnt about non-retroviral drugs like the herpes. Today we'll learn about treatment of HIV, which is a retrovirus. How does a retrovirus or a HIV virus replicate? First, the HIV virus binds to the host cell using certain chemokine receptors like CCR5 and CD4. After this, the capsid gets dissolved, releasing the RNA. This RNA is from the RNA, reverse transcriptase enzyme acts to produce double-stranded DNA. This double-stranded DNA acts to get integrated by the enzyme integrase into the host nucleus. Once it gets integrated in the host nucleus, it undergoes transcription to produce mRNA, which undergoes translation, thus producing proteins and also the viral genome. All this are integrated, matured, assembled and released to form new viruses. So hence we understood that in retrovirus and non-retrovirus, what is the difference? There is integration of the viral genome into the host nucleus. With this, let's try to understand how we treat HIV. What are the drugs used in the treatment of HIV? First of all, we have nucleoside reverse transcriptase inhibitors. We have non-nucleoside reverse transcriptase inhibitors. We have protease inhibitors. We have integrase inhibitors and CD4 based therapies. We'll look into each one of them. First, let's try to understand nucleoside reverse transcriptase and non-nucleoside reverse transcriptase enzyme. So, what are these nucleoside reverse transcriptase inhibitors? Let's first name the drugs. Zidovudine, Stavudine, Didanosine, LAMIVUDINE, Abacavir, Emtricitabine and Tenofovir. These resemble certain nucleosides. Like Zidovudine and Stamivudine are thymidine analogues, whereas Didanosine and LAMIVUDINE are purine or cytidine analogues. Abacavir is a guanosine analog. Tenofovir is a adenosine analog. There are non-nucleoside reverse transcriptase inhibitors as well. These are not structurally similar to any of the nucleosides like nevirapine, delaviridine, efavirenz, ertavirin and rilpivirine. The next categories are protease inhibitors. We'll learn about this in the next slides. And we have CD4 based therapies, namely CCR5 antagonists and fusion entry inhibitors. We also have integrase inhibitors. So where do these act? The first one was nucleoside reverse transcriptase inhibitors. So nucleoside and non-nucleoside reverse transcriptase inhibitors inhibit formation of double-stranded DNA from RNA. So they inhibit the reverse transcriptase. How does protease inhibitors function? They inhibit the assembly. How does integrase inhibitors function? They inhibit the integration of viral DNA into the host DNA. The last group inhibits CD4 and chemokine receptors, thus inhibiting the binding of the viral DNA onto the host cell. So first let's look into nucleoside reverse transcriptase inhibitors. Let's look into the first drug, Zidovudine. Zidovudine is a thymidine analog. So how do these function? Nucleoside reverse transcriptase inhibitors, zidovudine, acts as a false nucleotide and also functions as a competitive inhibitor. So let's look into this. First, similar to that of our non-retroviral drugs, zidovudine or azithromycin is first activated. So it is phosphorylated 3 times. Monophosphate, diphosphate and triphosphate. This competitively inhibits HIV reverse transcriptase and DNA polymerase. HIV reverse transcriptase. Transcriptase is an enzyme which converts RNA of the virus into double-stranded DNA. This also inhibits incorporation of the pro-DNA chain and also prematurely terminates the formation of the DNA. Thus, zidovudine prevents infection of new cells. Zidovudine is orally absorbed. Bioavailability is around 65%. It's given twice daily. It is metabolized by glucuronidation and is excreted to the kidneys. It is effective. It is given in pregnancy. It is effective as post-exposure prophylaxis also. What are the adverse effects of zidovudine? Zidovudine has a propensity to bind to mitochondrial DNA polymerase. Hence, it can cause bone marrow depression, abdominal pain, anemia, neutropenia, myalgia, insomnia. Among this, anemia is the most common side effects of zidovudine. Where do we use zidovudine? Zidovudine is used as a first line of therapy in antiretroviral treatment of HIV. It is also used in post-exposure prophylaxis. For an infant of a mother who is HIV positive, also we use zidovudine to prevent HIV infection in the infant or in the newborn. So we understood zidovudine mechanism of action. It is a reverse transcriptase inhibitor. It inhibits the formation of DNA. Inhibits the formation of DNA. Adverse effects: anemia, neutropenia, myalgia. It's used in the treatment of HIV and it's also used in post-exposure prophylaxis and for a newborn of a HIV positive mother. Coming to the next drugs, among the nucleoside reverse transcriptase, are also called as NRTI. Didanosine, it's similar to that of zidovudine, but it is given once a day dosing. This can cause peripheral distal sensory neuropathy and dose-dependent pancreatitis and retinal changes. Stavudine is also a thymidine analog which is also used in the treatment of HIV and hepatitis B infection. This is also given once a day and we can give it for pre-exposure prophylaxis. LAMIVUDINE is one more drug which is also used in HIV and hepatitis B infection. Here the systemic toxicity is low, hence it's quite frequently used in treatment of HIV and HBV. What are the adverse effects? Headache, anorexia, abdominal pain and insomnia. Emtricitabine is a fluorinated analog of lamivudine. This has a high bioavailability, hence emtricitabine also is used. Abacavir is a guanosine analog. Once a day dosing. Renal excretion is after glucuronidation in the liver. Tenofovir is a adenosine. analog, adenosine analog. This requires only 2 activations. It is also already a monophosphate, so it requires only di and triphosphates. So only 2 phosphates are added. It is a once daily dosing. It's given in pregnancy and for post-exposure, pre-exposure prophylaxis. It's a nucleoside analog. So we just now learnt about nucleotide analogs. Let's try to learn about the other groups. So now we learnt about nucleoside reverse transcriptase inhibitors, Zidovudine, stavudine, didanosine, lamivudine, abacavir, emtricitabine and tenofovir. How do this function? These function as a false nucleotide and also as a competitive inhibitors. Now let's move on to non-nucleoside reverse transcriptase inhibitors. Example, nevirapine. This binds to reverse transcriptase and inhibits the enzyme. Let's look into this. So coming back to non-nucleoside reverse transcriptase inhibitors. Nevirapine, delaviridine, efavirenz, entravirin and rilpivirine. So where do these function? These function similar to that of nucleoside reverse transcriptase inhibitors, where from our viral RNA double-stranded viral DNA is formed. This is with the help of the enzyme reverse transcriptase, which is inhibited by this group. But non-nucleotide reverse transcriptase inhibitors are not analogs, are not structurally similar to that of any nucleotide or nucleoside. These don't require activation or they don't require phosphorylation. They directly bind and inhibit the reverse transcriptase. Not only this, it's a non-competitive inhibition, whereas NRTIs, nucleoside reverse transcriptase inhibitors, are competitive inhibition. They also get incorporated into the chain, DNA chain, and they can cause premature termination. What are the toxicities? Toxicities are similar to that of NRTIs, like mitochondrial toxicity, peripheral neuropathy, pancreatitis, lipoatrophy and hepatic steatosis. The older ones are delaviridine, efavirenz and nevirapine. Newer ones are etavirin. Single drugs, when we look into the treatment, we'll understand none of these drugs are used singly. Either NRTIs or NNRTIs. They are usually given in combinations. When we look into the heart regime, we'll see HIART, heart regime, which is used in the treatment of HIV. We'll see what are the combinations. And these are either enzyme inducers or enzyme inhibitors. Most of them are enzyme inducers. So when a patient has tuberculosis, if the patient is on nevirapine, we'll have to change it. So we understood few guidelines. No single drug is given. And when you're combining 2 or 3 drugs, you need to look for enzyme induction or enzyme inhibition. First, let's look at the drug nevirapine. It is well absorbed, orally given, plasma protein binding 99%, CSF concentration around 45%, used to prevent vertical transmission. That is, from the mother to the newborn. When the baby is born, vertical transmission to prevent, we can use. Skin rash and liver toxicity, and most of the NNRTIs are known to cause liver toxicity. Efavirenz is similar to that of nevirapine, but this is teratogenic. So the first 8 weeks of pregnancy, we are not going to be giving this, and it can cause crystalluria. Etavirin, it's given once daily. It's a newer drug, newer NNRTI. Revilepine is also a newer drug which is well absorbed 90%, but this can be given during pregnancy and it can cause liver toxicity along with QT prolongation. Delaviridine is also teratogenic. What are the adverse effects of NNRTIs? NNRTIs in a whole, nevirapine is known to cause Stevens-Johnson syndrome, hepatitis and neuropsychiatric illnesses. Efavirenz can cause insomnia, headache, increase in liver enzymes, cholesterol, and it is teratogenic. Tenofovir can cause flatulence, osteomalacia, acute renal failure and Fanconi's syndrome. So we learned about the treatment of HIV. We learned about two groups. One NRTIs and the other one was NNRTIs, nucleoside reverse transcriptase inhibitors and non-nucleoside reverse transcriptase inhibitors. In the next class, we'll learn about protease inhibitors, integrase inhibitors and entry inhibitors, that is CD4 based therapies, and we'll also learn about heart therapy used in the treatment of HIV. These are the portions for the upcoming internal assessment. All the portions completed during the lockdown, which will include CNS as well as chemotherapy and all the topics which are completed as on date. Thank you.